Hello everyone, you're watching sqadia.com and I am Hammad Haider. Today our topic is the joint and ligamentous injuries of hand. We will have 4 sections. In the first section we're discussing some of the hand dislocations, especially in the first section we're discussing the carpometacarpal dislocations, which is most commonly associated with thumb, and in thumb's chronic instability, and lastly we'll be discussing 4th and 5th finger carpometacarpal joint dislocation. Usually most commonly it is involved with the thumb, but sometimes even the 5th finger can also occur. Then the second section will be going through towards the metacarpophalangeal dislocation, which is relatively more common as compared to carpometacarpal dislocation. We'll be discussing simple dislocation, which is without any ligamentous injury, which is complex dislocation, which is associated with injury to the palmar plate and associated fractures as well. And we'll be briefly discussing the chronic instability associated with the carpometacarpal fractures, and what are the management options we have for that. In the third section, we're going through the phalangeal joint ligaments, different ligaments which can get injured, and how to diagnose them and what is the management options. Especially, we'll be going through the interphalangeal joint dislocation, which is between the two phalanges, especially the proximal interphalangeal joint dislocation. Then we'll briefly covering the pylon fractures of the middle phalanx, although these fractures are mainly pathognomic of distal tibia, but they are also rare present as well, and sometimes called as pylon fracture of the middle phalanx, when the proximal phalanx head jams into the middle phalanx, and that usually results in a comminuted fracture. Then we will be discussing the condylar fractures and volar fracture dislocation of the proximal phalanx. In the last section, we will be going to some of the ligamentous injuries of the hand. Especially, we'll be covering the 2 important ligaments. One is the radial collateral ligaments of the index finger, which although very rare but can get injured. And then the most importantly is we'll be discussing an entity called as gamekeeper's thumb. It's called as gamekeeper thumbs because it is actually ulnar collateral ligamentous insufficiency of the thumb metacarpophalangeal joint, and we will be discussing its pathophysiology, pathoanatomy, and its management options as well. Thank you very much. Keep watching sqadia.com.